health data can play an integral role in facilitating earlier diagnosis. Because of the rarity of PID, patients are often geographically widespread, which means that health information collected from these patients is also widely dispersed. With each diagnosis made, health data can be collected and shared in databases, allowing healthcare professionals and researchers around the world to identify patterns in clinical manifestations, and to even identify early warning signs among certain or similar PIDs. The pooling of health data can lead to new diagnoses amongst groups of undiagnosed patients that present with similar signs and symptoms. Additionally, when a known genetic variant is detected, we rely on health databases to determine whether a patient's clinical features match those of other patients with the same variant, thus confirming a diagnosis. Keeping up to date with current diagnostic guidelines and protocols for management of these rare conditions can be a challenge for primary care physicians. But primary care physicians are often the first line of contact with healthcare, so these knowledge gaps can delay diagnosis and treatment for patients with PID. The collection and sharing of health data is integral to close this gap and to aid primary care physicians in recognizing the classic signs of PID, so patients can be connected with the necessary specialists in a timely manner. The vast spectrum of clinical manifestations that are seen in PID requires that physicians of all disciplines are aware of PID. Specialized centers for primary immunodeficiency, such as SickKids, can play a significant role in increasing awareness of PID amongst primary care physicians and the public by sharing data retrieved through our specialized technologies and our concentrated access to hundreds of patients with PID. Data is often limited or siloed in specialty care facilities in countries with advanced healthcare technologies. So data sharing then becomes essential when it comes to rare conditions such as PID. Rather than working in isolation, data sharing allows researchers to build off of one another's work, saving resources and duplication of efforts. Reviewing health data serves as an opportunity for specialists across the nation and even internationally to discuss clinical observations, treatment outcomes, and insights to underlying disease mechanisms that can aid in clinical decision-making. When it comes to clinical trials, the pooling of health data can strengthen the evidence base for novel treatments and hasten advancements in PID care. This can also be important in advocating for funding for certain screening or treatment modalities, such as newborn screening or genetic testing. Sharing health data can allow us to gain new perspectives and to identify areas for improvement in clinical care, resulting in better treatment outcomes and long-term quality of life for patients with PID. Over the years, our field has seen generations of patients affected by PID, and how with each generation, there are improvements in care. This is largely due to the impact of data. Data sharing is imperative to improve the diagnosis and care of patients living with PID, while also contributing to the development of research and innovation for future generations to come.